Hi, welcome to a session of clinical tips with Dr. Jin Kim. I am Jin Kim. I am the board certified periodontist with practices in several locations in Southern California, Diamond Bar, Garden Grove, and Santa Monica. Today I'm going to talk about soft tissue augmentation. Soft tissue augmentation is a procedure done extremely commonly in today's periodontal practices. Periodontists or gum disease specialists do soft tissue surgery of many times. Many times we call this periodontal plastic surgery. Here are a couple of examples of periodontal plastic surgery where gum is added where the gums have gone missing. You can see in these cases where the root surfaces are um, exposed, the gum that replaces it will get rid of the sensitivity, will get rid of the possibility of decay on the root surfaces, but of course it will be done for cosmetic reasons as well. Periodontal plastic surgery is done for a number of other reasons where the mouse may have not favorable anatomy, structural issues, and so on. And gum surgery to augment, to add gum, can be a very valuable procedure that allows new gum to form where it has been missing. It is commonly done with restorative procedures, crowns, bridges, implants, and so on. These procedures can be divided broadly into connective tissue grafts, autologous epithelial graft. We use those specific words because a more commonly colloquially used term is called the free gingival graft. There's a lot of weird connotations to that unusual word, so we use the epithelial graft as a preferred word. Dermal matrix. This is where skin from other human beings, from cadavers that are processed, can be used, as well as other collagen materials from animal sources and whatnot. And more recently, pinhole rejuvenation, pinhole gum surgery, popularized by Dr. John Chow, a very good friend of mine and colleague, is yet another excellent method that is used. So what is it that happens when gum is added or gum is augmented in the mouth around teeth, around dental implants? As this diagram shows, this is one example of how gum tissue is being added onto the surface around an implant. Back in 1995, a very interesting, earth-shattering publication, in my opinion, appeared in the dental literature. The author is Kirk Pasquinelli. He is a periodontist like myself in the city of San Francisco. He had shown without a doubt that soft tissue graft causes new bone to form. This was speculated up until that time, but nobody had really shown it very definitively. So this is a very interesting case report where a patient had to have a soft tissue graft, and only about 10 months later, she needed to have the tooth removed for orthodontic reasons. And for some strange reason, for our benefit, the patient agreed to have the whole section of the graft together with the tooth removed for scientific purposes. And to the brilliance of Dr. Pasquinelli, he had looked at this under the microscope, and this is actually from his article, very successful soft tissue grafting that covered the root 100%, and that piece of the tissue that was taken and looked under the microscope showed at least 4 millimeters of new bone had formed. This is incredible. Anyhow, so that is the basis of how we tend to do soft tissue grafting in today's world. Today I wanted to introduce a single case. This is a 35-year-old young, healthy individual. Just this gentleman has a number of gum recession, gingival recessions throughout the mouth. If you look at just the teeth and the gums, you might think this is a much older gentleman than a 35-year-old healthy individual. But let's look at this area very carefully. Here is an upper canine that has a significant amount of root surface exposed, among many other teeth, and we are going to look at that very carefully. One of the primary causes is trauma from occlusion, bad bite. When somebody has a bad bite, It can cause enamel, the surface of the teeth, to wear. This gentleman clearly had that. It can cause bone damage to happen, bone loss. And in this gentleman, this also happened in his case. Drifting of teeth. He had already had orthodontic treatment, but the teeth were quite unstable, and currently we are using a night guard appliance to try to minimize teeth from moving, as well as to dampen the trauma that is he's facing. Abfraction is a term given to when the root surfaces are physically damaged, and is believed to be a number of reasons. Toothbrush is sometimes accused, but more so it's the physical stress put on the tooth and some of the crystalline structure of the tooth structure that chips away at the weakest point is a physical phenomena. And of course, gingival recession, as we have talked about. That's not the whole story, of course. This gentleman tends to have very thin tissue to begin with, thin biotype, as we say, and thin bone, thin gums to begin with is a preceding factor as to why damage like this can happen. I've actually treated this gentleman over a period of time, and we've done quite a few series of soft tissue augmentation procedures, but today I'm going to introduce just one. This is an upper canine. The tooth in the center of the screen has gum that is clearly missing. That is a long tooth, unusual, but pay attention to the remaining gum tissue. It is thin, is paper thin. You can almost see right through it, and sure enough, it is going to continue to get disappearing, in front of our eyes. Luckily, this gentleman, like many others, has plenty of thick tissue right in this spot, which is the upper left back area where wisdom teeth generally are. And from that area, I'm able to secure some soft tissue that is of no consequence because tissue tends to grow back and the area heals quite well. So this is actually called subepithelium, meaning under the epithelium, underneath the surface, connective tissue, which is a general tissue that fills a lot of the space underneath. This tissue has amazing properties. It's got some collagen, it's got lots of vital cells, but it has cells that have the potential to grow new bone, as was depicted in the previous landmark article that I had introduced. So the surgical technique here is to create a space underneath the gum line. We literally separate the gum, and then what is noted here, the yellow semi-transparent material that you see on the right is actually clot of platelet. Yes, this is from the patient's blood. We draw the venous blood, we use centrifuge to collect the platelets, and then platelets which contain a lot of autologous, that's patient's own growth factors, are introduced into the area together with the two pieces of the connective tissue. Sutures are carefully placed to secure the graft so it doesn't move, it can heal without incident, and here we have it. This is the before, and as we see in front of our eyes, this is a beautiful outcome of soft tissue augmentation that made the area thicker. The tissue is a lot healthier. The tissue is bound down and secure. It resists pull, it resists any trauma, toothbrush abrasion, food being rubbed against the area, and so on. But more importantly, it covers the root surface. So any of that weaker root surface that was exposed is no longer exposed, and therefore the risk is minimized. This is a different angle that we're looking at, and it shows how beautifully the new tissue has formed. And we can look at it in a variety of different ways to see the before and after and to appreciate what kind of a change we can see. Of course, it's going to need a few more in some of the teeth towards the back, but we are at this point very happy to see that this one area of significant soft tissue loss is recovered and restored to its original ideal health. But of course, remember what I said. This, when we look at the patient's CBCT, cone beam CT computed tomography radiograph, which kind of takes away all the soft tissue and gives us the ability to look with X-ray vision, so to speak. If you look at it, compare the right and the left canine. We chose this canine as a first tooth to treat because obviously it had the least amount of bone and it was more problematic. So here I have inserted the X-ray vision showing where the bone is deficient, and now you know where this is going. We leave it for at least 10 months, according to the previous article, we will have some degree of new bone forming in this area. So periodontal plastic surgery is something that we have been performing in our field for the past several decades. It is a very, very useful procedure for many of our patients who are suffering from this very common condition. And in this case, this particular case is known as the subepithelial connective tissue graft. Connective tissue that we get from slightly below the surface and is grafted. It's an autologous or graft of the self, taken from the same person to that exact same person. So, are you missing gum tissue? Do you have gum recession? Very common amongst many of the modern, human beings. And that truly means you're missing bone. That's the reason why we find this procedure to be quite helpful. So soft tissue augmentation is something we do very commonly. Go see a periodontist in your area to be able to see if they can perform this type of procedure to fix the problem in your mouth right now. Subscribe to us and look forward to many other videos that I'll be producing in the future. Thank you very much. This has been Jin Kim, a dual board certified specialist in the field of periodontics and dental implants here in warm Southern California.